There is some breaking news that is coming out that I thought I would share with you. I've got this from Reuters, but the full article is in the Washington Post about the US CDC delaying publishing a report showing the positive benefit of COVID vaccination. As soon as I saw the article, I thought something doesn't seem to fit right there. So I thought I'd do a little bit of digging. Now, I don't have access to the full information, and I couldn't see the full Washington Post article, but I did. They seem to have found that when they did a study looking at people who were still being boosted, that there was an almost 50 to 55% reduction in emergency hospital admissions for COVID, and it seems also non COVID related mortality. That would put the vaccine in a category that makes it almost better than any other therapy you could come across. Now, I'm used to these kinds of studies coming up, hearing about how many millions. It was first 14 million saved, then it was 4 million, then it was down to 2 million. And suddenly we're not sure if there are any lives saved. Nobody quite knows. And what we're facing is an ongoing narrative that doesn't seem to quite make sense. So I'll tell you some thoughts. And this is essentially what I'll be doing today, just giving you some thoughts. So the first thing that you have to do, let's go back to the article here. This is from Reuters, 9th of April, 2026, showing COVID vaccine benefits. And what it was saying in the article here is that the acting director for the CDC delayed publication of a CDC report showing that the COVID vaccine cut the likelihood of emergency department visits and hospitalizations for healthy adults last winter by about half. So, as I said, the Washington Post did the full story, and you would have to get back to it. Reuters could not immediately verify the report, but it does seem as though there is some accuracy to the fact that it cut emergency department visits and hospitalizations for healthy adults last winter by about half. Okay, I want to see the data because what I know is that people are not better, meaning that when you look at the population cohorts, you can see that the population is not well. It's not as if pre-pandemic and post-pandemic they are suddenly better off. So I know fundamentally there is something wrong. And as I had mentioned previously, when I looked at what changed after the pandemic, if you want to see the snapshot version, click in the description below. You can see multiple things are changing. And in the older adults, 60 to 74, a 237% increase in acute myocarditis. Now, I suspect this is not just the unvaccinated, because the vast majority of people in the UK in this age group are vaccinated. So when you see things like this happening, you know that generally it's suggesting that the population cannot be therefore better. So when you come to that question with the data that they're finding, what they are saying is that for people who have remained up to date with their booster, and at this point it may be number 9 or 10 or 11, compared to people who didn't stay up to date with their boosters, there is a 50% relative risk reduction in hospitalization and emergency admissions. Now, think about this carefully, because what they are comparing are two highly vaccinated cohorts, those who are up to date and those who are not. And I'd said before that what it appears to be happening, and this is something that the population needs to be told this, so I shouldn't be saying this should have to be coming from public health. Once you're on the treadmill, you may not be easily able to get off it. You may notice that there is no huge agenda insisting on the never vaccinated to get vaccinated and their boosters. And this is largely because the data doesn't seem to support the fact that if you have natural immunity at this point, your risk of severe or even moderate disease is extremely low. It doesn't mean that you can't catch an infection, but once you understand the science, and the science behind it always indicated that as long as you have an early interferon response, when the virus infects the upper airways, as long as it triggers an early interferon response, even if there is some degree of viremia, you're unlikely to end up with severe disease, unless you, say, have underlying lung comorbidities. And so what we are looking at here is the reality that in cohorts who are highly vaccinated, stopping getting the vaccine seems to be associated with more adverse events, whether it's hospitalization from COVID or otherwise. So here is my thought. Why would someone who already had 8 or 9 boosters suddenly decide not to continue getting it? What I have observed and what I reflect on is that people usually do that when they have an adverse response. If they have never had anything wrong with them and they're tolerating all the doses and it's just like a tiny injection, no big deal, they continue getting it. But once people start to have adverse responses for which they are unsure if it could be connected, or they felt unwell after they had their latest update, that is the kind of thing that will make them not take another one. And so what we may be looking at, and this is why we need the data, is not that the vaccine is protective, it's that the cohort who didn't take the vaccine may have had adverse responses. Certainly, from a non-COVID perspective, that's what makes sense. From a COVID perspective, yes, I could understand that if you were up to date, you had high levels of IgG4, because this is what tends to happen with the booster dose, you will have less of an immune response on getting infected. It doesn't mean you're not going to get infected, because IgG4 doesn't really block infection. It tells the immune system to stand down. Conversely, people who didn't get the updated booster, then getting a COVID infection, may be more likely to have immune responses, cytokine storms like more severe COVID, and therefore leading to hospitalization. So that makes sense. What doesn't make sense is non-COVID hospitalization, because as far as I know, as I told you, when we look at the UK, in highly vaccinated cohorts, 60 to 74 years old, there is a 237% increase in myocarditis. This is very unusual. And so what it indicates is that this is unlikely to be protective. So when we see a difference in highly vaccinated cohorts, it raises the question whether or not what you are seeing is that people who haven't continued to be boosted are then suffering from some kind of adverse response which prevented them from continuing to get doses. I would really be interested to understand why people who had 8 or 9 boosters, why would they stop? If they were able to take it for that long, what reason would they have to say, well, I've had enough? Is it that they think that they needed up to 8 boosters and then the 9th is unnecessary? Why not stop at the first booster dose, if you see what I mean? And these are the questions that they should be clarifying in the public. What is the real reason why those cohorts stopped taking it? Was it because of adverse responses, or was it because they just couldn't be bothered? That's why I said we need the data. But one thing is for certain, I don't for any moment think that this is indicating that they are somehow more protected than the never vaccinated. They are in a completely different cohort. And what's interesting is they are no longer even being studied. So they no longer look at the outcomes for the never vaccinated, either because they don't care that they're all going to die, or maybe they know they seem to be okay. All of these things still need to be clarified, and a lot more research has to be done. But as I have predicted, the longer we have a situation with ongoing viral circulation in populations who have been immune primed, where the primary driver for dysregulation of the immune system seems to be related to the spike protein, one can anticipate longer term issues as we continue beyond the pandemic. Those are just my thoughts. And again, if you're just joining us, just to mention the point, this is the latest news that the CDC has delayed publishing this report, which shows that the COVID vaccine boosted cohorts have technically, as it says here, a 50% reduction if they were healthy in hospitalization compared to the unboosted cohort. So this is comparing the vaccinated cohort, boosted versus unboosted, up to date, to see that there seems to be a difference. My question is why? What is the mechanism? Why does it happen? And we need some degree of clarity about what can be mitigated for those who may be affected. Have a great evening as we continue to share with you the latest information. Remember, coming up in about a week's time, the neurological shift after the pandemic. This is in the description below. You can click on the link. And if you want to see the pandemic data, the public version that has been somewhat redacted, that is again in the description. Have a great evening. Look forward to talking to you again soon.